All right, we are back talking about aching joints, and so Dr. Ulric Bigby is with us. Again, he's from Cone Health Orthocare in Alamance. All right, so in some situations, people get steroid injections or they get a cream. Are these long-term solutions, and what should we know about them?
Yeah, so creams, steroid injections, and steroid injections specifically, they're a great short-term solution for pain. We can inject a steroid in a numbing medicine into the knee or the aching joint, and that can help a lot with the pain. However, too many injections can damage the remaining cartilage. So we try to keep them to a minimum. We try to do one or two, and then figure out how to make you better through other methods.
Okay, so we hear a lot about non-surgical types of things, regenerative treatments and that kind of stuff. Is there a place for those, and what are our options for that?
Yeah, no, that's a great question. That's probably one of the most common questions I get in my office. There's unfortunately in orthopedics, there's not really a place at this point yet for regenerative medicine. We have not figured out how to regrow cartilage. Once we get to the point where the other things aren't working, that's when we start to really talk about and consider surgery.
Yeah, we need that, right? That cartilage growing thing, that's going to happen
We
at some
do.
point.
I think it'll happen eventually.
In the meantime, for people who are just really just not ready to talk about the possibility of surgery and they opt to live with the pain, what do you say to that?
Sure. So, I say to them much of what we've already talked about. So I tell them, rest and ice the knee, anti-inflammatories or Tylenol for pain. Something we haven't spoken yet about, but physical therapy can be very beneficial. Going in and getting your joint moving and getting it stronger, which can add support to the joint and take away from the pain as well. And then, injections and the creams can help. But again, once those things aren't working, I tell patients, it's okay to not want surgery, but these things aren't helping anymore. You might have this pain for the rest of your life. And surgery at this point in time, surgery is a great option.
Yeah, that's a tough thing to hear, that you're going to have this pain the rest of your life.
Exactly.
All right,
Yeah,
so
no,
to learn more about how to relieve pain or possible surgical options or what your other options are, do you go straight to an orthopedic surgeon? Do you start with your primary care provider? What do you do?
well, yeah, you can actually do either. Your Cone Health Orthocare. We don't require referrals most of the time, so patients can call in or go to our website conehealth.com/orthocare and make an appointment. Sometimes we do require referral, and at that time, either we contact or you can contact your primary care and get a referral and get you in and be happy to see you. Yeah.
Okay, we've got about a minute and a half or so, so let's talk about final thoughts about helping aching joints. Either A, what to do so that you don't get aching joints, and I don't even know if that's a possibility, and then B, what to do when you have the aching joints.
Yeah, so it is a possibility. Number one, healthy diet, very important. Healthy diet can be anti-inflammatory, can help with your joints. Number two, what a healthy diet does is it keeps your weight down. Increased weight puts more pressure on your joints, which can cause your joints to ache, number one, and number two, can cause you to develop arthritis earlier. And then, of course, once you have the aching joints, come in to be seen either by your primary care doctor or your orthopedic surgeon. We'll determine what's going on and determine the best course of action to make you feel better, hopefully without surgery. And then if that doesn't work, sometimes, we can transition to surgery and make you better in that way.
Real quick, give me some ideas about an anti-inflammatory diet.
So fruits, of course, check with your primary care, to make sure you can eat these things. If you're diabetic, sometimes you have to avoid those. But fruits can be anti-inflammatory. Vegetables can be anti-inflammatory. Those are the main things, and keeping a healthy diet that's well balanced. Not too many carbs, not too many meats, can help a lot with joint pain.
Okay, well, we appreciate your time and your expertise. And you know what, we're going to be putting this same interview in the To Your Well-Being section of our website so that you can watch it again. Maybe you need to send it to a friend or a family member. Right now, we're going to get caught up on the forecast.